you ever wondered why some tablets dissolve quickly in your stomach, while others just don't seem to break down at all? What if I tell you the secret often lies in something as simple as soap-like molecules called surfactants? Let me tell you a story. A few years ago, a pharma company developed a powerful antifungal drug. On paper, it was excellent. But when patients took the tablet, it failed to work. The reason? The drug dissolved in the acidic stomach, but quickly precipitated when it reached the intestine. The solution came not from inventing a new molecule, but from using the right surfactant in the dissolution medium. So what exactly are surfactants, and why are they game changers in dissolution testing? Let's break it down. Think of surfactants like dishwashing liquid. Oil and water don't mix, but add a drop of detergent and suddenly everything blends. In the same way, surfactants reduce surface tension, form micelles, and help poorly soluble drugs dissolve. Take the example of Itraconazole, a drug used for fungal infections. Without surfactants, it simply refuses to release properly in dissolution tests. But when sodium lauryl sulfate, SLS, is added, the drug solubilizes and shows measurable release. Without surfactants, it could have failed development. Surfactants aren't just lab tricks. They mimic the real body environment. In our intestines, bile salts and phospholipids act as natural surfactants, helping fats and lipophilic drugs dissolve. That's why simulated intestinal fluids like FASIF and FESIF include bile salts plus lecithin. Improve solubility, help dissolve lipophilic drugs, mimic physiology, simulate bile salts in GI tract, prevent precipitation, stabilize drugs like weak bases, enable discrimination, differentiate between good and bad formulations, reduce variability, ensure consistent results with hydrophobic APIs. Now imagine you're formulating Ritonavir. It dissolves poorly, so you add SLS. But how much should you add? If you use too little, it won't help. Too much, and every formulation looks perfect, masking real differences. This is where the concept of critical micelle concentration, CMC, comes in. The trick is to stay just above CMC but not go overboard. Always consider physiological relevance. Does the surfactant mimic GI fluids? Think of analytical compatibility. Will it interfere with HPLC peaks? Follow regulatory precedents. Check USP or FDA guidance. And never forget safety. Use only pharmaceutically approved surfactants. So next time you see a tablet dissolve, remember, it's not just the drug doing the magic. Sometimes it's the silent role of surfactants ensuring patients get the right dose at the right time. This was your EduDose with me, Dr. Satish Polshettiwar, where we simplify complex pharmacy concepts through stories and real cases. If you found this useful, don't forget to like, share, and subscribe for your weekly dose of easy learning.
This video helpful, please subscribe, like, and share it with others who'd benefit. See you in the next video.